David, can you go ahead and hit record and then we'll start?
Okay. Good morning, everyone. For those of you who are joining us, for my esteemed panelists, it's a pleasure to be here. We're glad you're able to join us today. And this webinar is titled Advancing Menstrual Equity at the Systemic Level Through Policy Shifts and Standards. So it's very current. It's a very relevant webinar to be having right now, given how much we're trying to advance menstrual equality. My name is Janet Mbogwa. I am Kenyan, based in Nairobi, and I've just been very passionate about advancing menstrual equality messaging through my foundation, Inua Dada, which essentially intervenes for girls and women who don't have access to menstrual products, and has grown beyond that to include allies like men and the community leaders, and also touching on surrounding issues such as gender-based violence. I have a book called My First Time, which really talks about the first period that people experience as a way to use storytelling to demystify this very taboo issue. It's available in Kenya, will be available globally on Amazon very soon. So I'm excited about that. And Diana is a part of it, Diana of Days for Girls. And I really do believe in mobilizing as many people to this conversation so that it's front and center and not always seen as an other conversation. So on behalf of the African Coalition for Menstrual Health Management, Days for Girls International, and UNFPA East and Southern Africa Regional Office, or SRO, I'd like to welcome all of you. A few housekeeping rules for all our participants, and thank you for joining us from wherever you are. Please make sure that you remain on mute and off video. The video is going to be really just for our panelists and for ease of conversing with our panelists. You will be able to, however, send questions to us via the chat box. So make sure you do that as soon as we start the conversations. Any questions or comments? And in the interest of time, we may not be able to go through as many of them. We will try to go through some of them towards the end of this webinar. And any that have not been addressed, hopefully once you get the recording of this webinar, you'll be able to refresh your mind with some of the points that came out. So the webinar is being recorded for your information, and there will be a report on the same coming out about a month after the webinar. So just thought it's important that we tell you those housekeeping. And for our esteemed presenters and panelists, we do have a tight timeline. And so if you are able to keep your presentation to about 6 to 7 minutes, if I do need to step in and interrupt, it's not going to be out of being offensive. It's just simply to keep us on track and make sure that everybody gets a chance to present. Before I welcome my first speaker, please allow me to just read a few notes about why this webinar is so important and so timely. I'll make reference to a sheet that I have here. The theme recognizes that women and girls play very pivotal roles to help shape our future and our economies, especially during this pandemic. We've already heard the stories about how shadow pandemics have come out within this pandemic. Gender-based violence has been a really big one. Menstrual inequality has been another one. And so we've had a lot of women respond to the challenges that COVID has brought. And in order for menstruators to have an equal future and overcome the challenge of period poverty, we have to acknowledge that menstruators have human rights and that they have periods, and periods are normal. I feel like we need to have t-shirts saying periods are normal so that we can encourage generations to come to normalize it. And so to combat this challenge, the past decade, we've seen governments choosing to challenge menstrual stigma and barriers in communities. We've seen this in South Africa with their sanitary dignity implementation framework, and with the publication of Kenya's menstrual hygiene management policy in 2020. I was incredibly honored to have been a part of that launch. And most recently with the Kenya Bureau of Standards publishing the reusable sanitary towel standard, which was momentous, and we're so grateful for that. It allows menstruators another safe option to manage their periods. And so the support from Kenya's Ministry of Health for this standard demonstrates the commitment of our government to really make sure that menstruation is taken seriously and we begin eliminating period poverty. And so in the next hour, we will take a closer look at menstrual health policy wins and challenges in East and Southern Africa and hear practical lessons from panelists both in Kenya, Tanzania, and South Africa. The insight from my esteemed panel will help us better understand menstrual needs that need to be addressed at the systemic level through policy shifts and standards. And in addition, we'll discuss how the menstrual health conversation is changing and what is needed to advance menstrual health across the continent and lessons learned. I'm really excited about this because I think it's been a long time coming, and so I'm happy that we're finally here. And so I would like to invite our first presenter. I will invite presenters as and when it's their time. So I wouldn't kind of mention everyone's name right now. I'll start with each presenter, give a little bit of their title and hint at what they're going to be giving us in their presentations, and then move on to the next presenter. And so I'm happy to first invite Ibrahim Basweti. Ibrahim Basweti is the Senior Public Health Officer at the Ministry of Health. He's going to be giving us an overview of an orientation to Kenya's menstrual health policy and priorities. Some of the key notes will be implications for ministries and organizations like schools, implications for women and girls, and wins and challenges in policy implementation. Always so excited to have male allies in these conversations. And so, Ibrahim, we invite you to share your presentation with us. Thank you.
Thank you very much, Janet, for that very explicit word of encouragement. I want to invite everybody into this particular presentation, making sure that we are on the verge of this advancing the menstrual hygiene equity amongst menstruators, as it were. But first of all, I would want by mentioning that Kenya has Kenya Environmental Sanitation and Hygiene Policy, which is the overall policy that from which we had to look at how issues of menstrual hygiene management can be basically be unpacked and address that particular issue. And so we have got around five objectives of this. Maybe if you can look at what the Kenya's menstrual hygiene policy at a glance looks at, it is looking at how do we have that environment and the regulatory environment where both the national and county levels meet at one point and share these issues. The second objective, policy objective, is that, of course, there are myths and taboos and the stigma around menstruation. And by so, we want to look at how then do we address by providing women and girls, men and boys, access to information. This question is that once one is given the information is power, and therefore they can be able to unpack and come out of the myths. The policy objective number 3 is to ensure that women and girls have access to safe hygiene, menstrual products, services, and facilities, including workplaces, schools, and at their household levels. The policy objective number 4 is to ensure that we have then a clean and healthy environment to all Kenyans by using appropriate technologies in managing the wastes that have been generated so that we have an environment that is not polluted. Then, of course, the last and not least is objective policy number 5 that talks about the functionality and effective monitoring. Of course, there are new learnings that are coming in. What is it that we can do to maximize the accountability? And of course, that also goes a long way in looking at the implications of the menstrual hygiene management policy for girls. And what that means is that the importance of menstruation as a significant landmark of child growing. So this is really a natural phenomena that we need to support. The support for the menstrual hygiene education in the school curriculum is one of those things that has already been done. And this one, it goes along in fighting the stigma and also taboos and menstrual provision of pragmatic menstrual education and information in these particular institutions that we have talked about. And of course, we are also looking at how then do we promote the access of affordable, safe, hygienic menstrual hygiene management that can be affordable at that local level. You're aware that the Kenya Bureau of Standards have already regulated the reuse of menstrual hygiene management sanitary products. And really, this is one thing that we have fought over the years, and it works very, very, very well. So maybe we go look at what is it that, again, we need to address as a ministry and as at that national level. We also need to look at how do we strengthen the coordination among most of those other organizations that are carrying out management activities. What that means is that we need to integrate the menstrual hygiene management into the ministry's activities and programs, so that that issue of stigmatization is, unpacked. And so we also need to look at how can we run these activities of menstrual hygiene management across the board in all the ministries, in all the institutions, and other areas where women and girls are always, engraved in. So we are looking at what are those challenges that we are looking at the implementation level. We are looking at how do we take this advocacy into high level, which means the ministries who are involved, the line ministries who are involved, and we are looking at who is that person who is going to take lead, who is going to decide on the process, and giving feedback from the girls. Another area that we need to look at is that, of course, do we have enough data? How can data be the evidence of the policy development and implement the same? And of course, we look at what works and what does not work. And if it doesn't work, what is it that we can do? Another area is, as I already mentioned, is that the integration of this into the mainstream of the ministries and the workplaces, the household levels, and across the board where women and girls are. And I think it is really important that we need to look at that. At the same time, we are looking at how is it that we can be able to get funding for this. Janet, I can't hear you.
No. Please carry on, Ibrahim. Please carry on.
Okay.
Thank you.
Okay, thank you. And we are looking at the avenue of creating that the government funding for key and minimal, right now we don't have really a lot of funding coming into this particular area because it's a kind of, can say it's a gray area, but we need to look at how do we get maximize what is available so that it runs across the stream. And of course, we need to then to look at the costed plan, a costed investment plan that can be able to pick up those areas that are critical so that they can be supported by either ministries or other partners to see that women who really play a vital role have been given that environment that is so conducive. And of course, we need to then look at the coordination issues and look at all those stakeholders who have had an active role in the development of this policy and how they can be able to, take it into the next level. And of course, ensure that those people who are voiceless, their voices have been heard, more especially the people with the disabilities have also been included in this particular agenda. And of course, we need to look at how do we need to consult those ministries and those stakeholders, including development partners, who can be able to give the support so that we have our girls and women, because the conversation around here, it is really changing over time, and therefore we need to move to the right direction. Thank you. What to Janet?
Thank you so much for that, Ibrahim. I think that was so important to hear for various reasons. When we have high-level policy makers, especially one of the points you made about high-level adoption of policies, for example, looking at ending stigma. Data is so critical. All of which I think ties into, if this is handled or taken on from the highest level and adopted and implemented from the highest level, I think we will begin to see those shifts. So the ownership from the highest level is what I think is so critical. I thank you for your points and for bringing that out. Once again, just asking our participants, if you have any questions for Ibrahim and the other participants who will be speaking, please share them in the chat box so that he can address them alongside everybody else. I'd now like to move on to our next speaker, and that's Kenny Pasha. Kenny is going to be telling us a little bit more about lessons learned in South Africa. He is the Managing Director for Water and Sanitation, and he's going to be talking about lessons learned from implementing South Africa's Sanitary Dignity Implementation Framework. Kenny, if you could come to the light a little bit, I think we're seeing more of a silhouette of you as opposed to seeing your face clearly. I think where you're positioned, the light is kind of shining from the back of the room.
Okay.
It's,
Let me.
you know, if it's fine. So yes, I think Kenny is going to try and settle, and no pressure, Kenny. I think if we're unable to, it's fine. We can hear you, and that's what's important. So I'd like to now invite you, Kenny, to give us your presentation, please. Thank you.
Good morning, colleagues. Is there anyone going to help me to project my presentation?
Yes, I believe we have our colleague who's going to help with everyone's presentation. It should be coming up on the screen any minute now so that Kenny is able to do his presentation.
Fortunately,
Maybe well, all right.
Fortunately, I didn't get it, but I can walk you through just going.
Okay.
Yeah.
All right, Kenny, you can begin, and I think you know you offer guidance with regards to which slide comes next. When you want to come, just say next slide, please.
Okay. Colleagues, my name is Kenny Pasha from Tsogang Water and Sanitation. I'm the managing director of this organization. So I will actually talk more about implementation on the ground, what is actually happening on the ground. Because as an NGO, I won't dwell much about the policy framework. I'm sure our government in South Africa has done actually a lot when it comes to MHM, but I'll talk about those, I'm sure, towards the end of my presentation. Is actually Peter just thought maybe they'll be able to project it so that I can actually speak to it. But I think on the second slide, what I would actually like to say to all of you, to our viewers, is like, there are millions of women around the world who are actually suffering because of, the failure to actually manage this MHM properly in such a way that it actually affects their daily lives. This sometimes is because of lack of products. They don't actually really have the so-called sanitary towels. But again, there are other things that are actually related to menstruation, things like the pains that women actually have to go through, during their menstruation period. And the other thing is the lack of facilities. For example, when engineers design systems, let me just take, for example, an easy thing like an ablution facility. So wherever you go, you might actually find that, the way sanitation has actually been designed, it's actually designed in such a way that it's just for people to come and actually to relieve themselves. But they don't really actually take into account issues like the menstruation, hygiene. How does actually, for example, if the women are actually in their period, when they're actually in the toilet, how do they actually make sure that they've got the facility, to can actually keep themselves clean? So I think that is one thing for sure that is really creating a problem. And again, when it comes to young girls at school, this actually leads to dropout in some other areas, because it actually becomes a laughing, thing within their classrooms. When something like that actually happened without having the required products, a particular girl end up, being laughed, stuff like that, and that also have to go with the stigma attached to this. So that is actually the other thing that we have really witnessed on the ground. But other thing we have also encountered, especially when you talk to the principal of this school, the schoolmasters, they talked about the level of absenteeism in schools, especially when it comes to girls, because some girls will even refuse to come to school and say, you know what, we don't really have this and this and this. So if I go to schools, my classmate, they'll actually laugh at me, and all of these things, funny things will happen to me. So the third slide, I'm so sorry, colleagues, because you can't actually see what I'm actually presenting. This is actually in relation to the stigma and the taboos that you actually have to go with MHM. Culturally, when we were actually growing up, especially as men, but starting from being young boys, we actually never been taught about all these kind of things, what actually happened, to women until she is at this stage. So when actually some of these things happened, to us, it happens as if maybe, no, this person is just ignorant, or maybe she's actually failing to take care of herself. But again, the stigma attached to that, it also goes back to the cultural, the way things have actually been, discussed as in our culture. Because some cultures, women are not actually given enough time to can actually come and, like as we have the likes of Jeanette here and Geneva presenting, be able to speak for themselves. They're not actually being given chance to can actually explain some of these things. And by doing that, it will also actually help other people to learn from what actually happened, in the women's body as they actually grow up. And even their parents, sometimes some of our parents are still failing to talk to their ladies about, what, when you reach this stage, this is what will actually happen. When you reach this stage, this is actually what will actually. So all these things end up building into this, the stigma and the taboos actually attached to the menstruation MHM. And if you are not actually giving enough time, to deal with, it might actually, just keep on getting on and on and on. Because, for example, if I don't really talk to my young boy about what actually happened to my wife as a woman, and this will actually happen to himself, because one day
I'm not sure if it's my end as well, or if we are struggling to hear Kenny.
A wife in his family. So this is some of that, talking freely about some of these things. Those things that we have just going through now. Platform should actually just be made available so that we. Hello?
Yes, Kenny, sorry. Yeah, we had lost you there for a while. This is your presentation, so please continue.
Thank you very much. I'm actually now at slide number 3. I was talking to the stigma and the taboos, but we can actually quickly move to, I think, the slide number 3. I was just actually trying to emphasize that it is high time enough that men and boys need to be engaged more often about MHM, so that they can actually know what is actually happening through our women and our girls bodies as they grow up. So let's move to slide number 4. So colleagues, as we are actually a non-governmental organization, we have already started implementing some of these things on the ground, especially on our WASH program that we are running with Water Aid in some of the schools in Limpopo province. So I think last year, on the 1st of May, we also have this MHM, day celebration in schools. If you can actually look at the pictures there, we actually have the mixture, because we have boys, we have girls, we're all celebrating together, so that we can really try to make sure that we get this message into the boys that, whatever you are actually seeing with your young girls, it's not like it's a miracle. It's happening, it's part of life. So can we move to slide number 4? Move to slide number 5. So slide number 5 is, I talked about the facilities. You know, if you don't really make some of these facilities actually available to our young girls and women, we might actually, you know, make them struggle in life. So part of what we're actually doing, because we are actually building ablution facilities in schools, is just to make sure that maybe in each block, especially a block for young girls or even teachers, we also have this room that will actually have all what women will actually need. For example, when they're actually going through their menstruation period, so that they're actually able to, you know, clean themselves. We have the mirrors, they can even look whether they've actually wear things properly, you know, all those kind of things. So this is actually part of what we are actually doing in the schools. And we are actually also trying to get a buy-in from the government so that when they plan, you know, future interventions, especially sanitation in schools, but also I think in communities, they must also take into consideration this issue of women-friendly or female-friendly toilets so that our women are well actually taken care of. So let's move to slide number 6. It's all still actually talking to the female-friendly toilets, but I think on my closing, one thing for sure that I'll actually say to my colleagues is like, we all, I'm sure, heard about or maybe experienced the impact of what this pandemic has actually done to our communities at large. So as part of our COVID-19 intervention, what we did, we worked in communities, plus minus 20 communities around Vende district municipality, whereby local stakeholders actually help us to identify vulnerable families. These are families whereby they are either they are actually they are beneficiary, or maybe the main provider in that particular household has actually lost jobs and people don't actually have anything, you know, to help themselves. So we actually, through our support from WaterAid, from the support from WaterAid and other agencies, we managed to distribute sanitary towels to these vulnerable families so that when they actually go through their menstruation period, they will at least have time. They will actually have products, you know, to take care of. So, but I think the other thing, as I'm actually going towards the end of my presentation, is to emphasize the importance of knowledge. It is actually very much important. I'm not sure, but maybe talking to the Department of Education, just to make sure that as part of their curriculum, they also maybe have sessions whereby they just talk, you know, freely, you know, to especially young boys about, you know, this, you know, menstruation and how it actually happens. With girls, how better you can actually be able to manage this so that it doesn't really have to affect the way you live. And then in closing, I will actually talk much about the government, even though I'm actually from the NGO's point of view. I think somebody earlier on mentioned the issue of the sanitary dignity program or framework program that our government in South Africa has already started. It has actually already started. Our government is doing a lot. So, but yes, there might actually be one province here and there which are actually still struggling to implement. But when you actually look around, I think most of the provinces are actually able to implement this program. They've started distributing sanitary towels to our young girls at schools. Thank you very much, because they also, as the department, as the government, through the Department of Women and People with Disability, we also managed to establish the South African Coalition just to look at this MHN, which I'm also actually part of it as an organization. So that will actually give us, you know, a platform, you know, a chance as an NGO to raise some of the experiences and the things that we are actually encountering, especially when it comes to implementation. So I can actually see, Janet, I'm sure I'm running out of time. Colleagues, for now, let me just actually leave it here. I'm so sorry. We actually experienced this, you know, electricity problem in our area. That is why, you know, my room is dark like this. We don't actually have electricity. I just have a means to get connected.
Totally okay, Kenny. We understand. Thank you for your passion in your presentation. At least we were able to see some of the slides towards the end. You're obviously somebody who's trying to push for behavior change. Being able to teach boys about menstruation so that it doesn't become this big stigma conversation when they're old. I think that was really important to hear. The facilities, I think, are a fantastic idea. I'm hoping either later in this conversation or down the line, I'd really love to hear how the government is responding to some of these proposals in terms of having facilities that are so menstruator friendly. And just looking at the images there, I think that's really great. And you speaking there at the end about knowledge being everything, I can't echo that enough. I think when we have the right knowledge from a very early stage, then we're able to handle and address this issue really well. So thank you for capturing all that, Kenny. Again, for all of those who are putting in questions in the chat box, you can direct issues so far to Ibrahim and Kenny who've spoken, and to all the other panelists who are going to come round. Our next panelist is Titus Oyo. He is the Health Standards Manager for the Kenya Bureau of Standards. He's going to be giving us details on an orientation to the new reusable sanitary towel standard from KEBS. We heard earlier on in the presentation that KEBS has already approved this reusable pad, which is a huge milestone in creating more access for different products for menstruators. So why a washable standard now? Implications for washable pad manufacturers and implications for manufacturers. We're hoping that all that will come out. Titus, if I can request you as well to turn on your video so that we can see you if you're comfortable. If not, you can unmute and I invite you to start sharing your presentation. Thank you. I'm not sure if Titus is able to hear. Again, I'll just mention that Titus, your presentation is next. If you're able to unmute and turn on your video so that we can see you. If not, I can see you've unmuted. So please begin your presentation.
Are you able to see me or hear me now?
We can hear you. We can hear you. We can't see you.
All right.
If you're unable to access your video. Oh, there we go. Fantastic. Thank you, Titus. Over to you.
I was also trying to share my screen. Are you able to see it?
Yes, we are. We're able to see the screen.
It's a short presentation that I want to run through in a matter of minutes because I was informed or rather advised that is an issue of 6 minutes. And some of us, we are very poor at speaking very fast. But I hope I will be audible and I hope to deliver the points home as effectively as is required. We are talking of menstrual hygiene through the lens of standardization. That would have been my topic. And I want to start with the strategies that the government is trying to use to avail safe, cost-effective, and of course, accessible menstrual materials. Because we are not concerned with the other services, at Kenya Bureau of Standards, I think our main concern is on materials. So the government of Kenya do promulgate requirements for manufacture, sale, and distribution of safe, accessible, and of course, effective materials. These are done through a number of channels, but one major channel is the Parliament, where we normally obtain acts of parliaments. And then from those particular acts of parliaments, there are rules that are developed by different ministry under the government. And this is done taking cognizance of the relevant World Trade Organization agreements that Kenya as a country have entered into. These requires us to take certain key considerations. And the considerations here would be that any regulation that is being done must be one that captures minimum quality requirements, like that one of Kenya, or where possible. We should also talk of a look at the issues of costs, because we are not coming from a point where we had nothing at all. We are coming from a point where we had other materials in the market, but we still want to ensure that accessibility is enhanced. And that one, for that one to be enhanced, then we should be also looking at issues of minimum cost compliance so that we can have more and more of our girls accessing these products. Issues of this, I mean, the regulations also must be one that benefits a larger section of our society. And lastly, it has to comply with the laws of the country. They also must, whenever we have had a regulation, we must be able to enforce them in a transparent manner. This is normally a bit difficult, and there will be a lot of issues coming out of that, but it should be done in a, and then they should also enhance equity at any given time. So standards as regulation normally does that. Regulation should also be drafted in a clear and simple language, as that one captured in the standards. We don't have to use jargons. We use English for English that everybody else should be able to understand for purposes of communication. So when you look at the Kenya standards, therefore, they are supposed to be communicating to whoever is interested, that is the stakeholder, and particularly the manufacturers, so that it is able to transfer manufacturing technology. And that is one of the purposes of standardization. And if required any given time, these regulations like the standards, they should also be done in such a manner that they allow for revision if required, they allow for amendment, they allow for corrigenda or addendums whenever such issues arise. It should not be so rigid as to disallow that. When you look at quality paradigm, and in Kenya, you have to look at quality infrastructure. And Kenya Bureau of Standards is actually under the Ministry of Industrialization, Trade and Cooperative Development. Which is, then there is the ADESC, Director of Foreign Trade, and under the Ministry of Trade, of Industrialization. So we have looked at matters, materials for menstrual use, and we find it to be an industrial issue. It is also a trade issue. Therefore, it inundates Kenya Bureau of Standards to come in a big way. Being a medical device, as it is today, then these materials are going to be enforced by the government agency, and that is the Pharmacy and Poisons Board, which is now supposed to be taking it from there once we already had it published as a standard. And then Kenya Bureau of Standards, of course, we also have got certain part to play. For example, prior to these products coming to the market, we have to ensure that they meet the minimum requirements of that standard, that is KS 2924. What's going to happen is that the organizations, but we have got other bodies like the Export Inspection Councils that are also concerned with aspects of exports. And the beauty about this is that we are now moving towards the phase of intra-African trade. And therefore, we expect that the availability of such reusable pads and materials will foster a lot of production or manufacture locally that can result into outward export within the African region, and if possible, who knows, internationally. I don't want, but I want to add and say that these are some of the things that we have talked about, that issues of compliance are strategic. They involve a lot of finance, but compliance is normally a bottom-line issue. We have got the right personnel to do the same through our arm of what do you call it, quality assurance and inspection, and of course the other people, market surveillance department, and of course in collaboration with the Pharmacy and Poisons Board, and of course with the public. Simply put, compliance is a responsibility and requires accountability. Therefore, we need to simplify the standards. We need to simplify matters of waste that are accruing from these materials, and if possible, accelerate matters compliance. It is key. There is the aspect of performance compliance, and then there is the technical and scientific competence and confidence, and then there's issues of moral and ethical competence, which are all encapsulated into the word compliance. Going forward, we realize that we have got also, whatever we're doing locally It's also being taken up and looked at internationally. And we are also members of ISO, just like we are also members of IEC. ISO is International Organization for Standardization. IEC is International Electrotechnical Commission, and KEBS is a member. So whatever we are doing here has got external implication. That means that it is a way of reorganizing trade in these products in such a manner that we have got harmonious development of standardization or other standards, quality control nationally and of course internationally. We also need to look at issues of certification schemes so that whatever schemes we have locally should be able to be mutually recognized with our trading partners. And then we need also to look at issues of growth and development of industries, particularly those industries that are locally embedded, for purposes of ensuring that we create jobs for our people and also we become a manufacturing hub. Of course, standards are also meant for purposes of protecting the consumer. So issues of consumer protection are very, very key in when it comes to development of standards. Primarily, national standards bodies are making standards that are, when they're published, they're normally voluntary. But because of their nature, like for example, the case of menstrual issues, it can be pronounced to be mandatory. And that can be coming through from the Ministry of Health, if they so decide.
Titus,
yes,
I'm sorry to interrupt you. You have about 2 minutes left of the presentation. Right. I just wanted to come in and tell you that. Thank you.
Thank you very much. So what we're saying is that standards, when published, they are normally voluntary, but they can be made mandatory through a pronouncement by the relevant enforcing agency. As it is, these standards are actually they are voluntary, but it depends, who knows, it can be made to be mandatory. What we have here are that we have got standards developed through a very rigorous process that normally ensures that all views are taken up. And if a view is not, does not find its way into the standard, that particular view is normally noted and it's also interrogated scientifically. And the reason for its exclusion is normally made public. But all views that are tenable are always finding their way into the standards. So that is what KEBS has done. And my last slide actually talks about that. You can actually look at it. So the standard is 2924 of 2020. And it is arranged in such a manner that it has got the scope. There are terms that are defined inside there. We have standardized materials. We have also looked at issues of absorbent fillers. We have looked at descriptions, order, absorbency, and so many other things that are also listed there. Based on well-defined schemes of testing and inspection, in the sense that all our testing facilities were actually vetted, and mostly the Kenya Bureau of Standards ones were found to be able to test these products fully. What I'm talking about is 100% testing. And this is going to ensure adequacy of in-process quality control by the local manufacturers. I think I want to end my discussion at this so that I don't take up a lot of your time. Thank you.
Thank you so much, Titus. It's such a critical aspect of access, quality control, because one of the biggest complaints from across the board has always been you're accessing a product, but it comes round to affect you because it hasn't met certain quality control standards. So thank you for outlining some of the technicalities behind that. And again, I can see quite a few of you participants have begun to send your questions. Please be sure to include your full name and the country that you're writing in from, just so that we can appreciate you as you're sending in your question to our panelists. We've already received quite a few. Hopefully we'll be able to capture quite a number of them towards the end of this presentation. And now I would like to move on to our next, thank you, Titus. Our next presenter is Jen Rubley, Research and M&E Coordinator, FEM International, and just going to talk a little bit to us about how the menstrual health conversation is changing, trends that you've seen, especially given the onset of COVID. So really looking forward to that. So Jen, over to you.
Great. Hello, everyone. I'm assuming we can see my screen.
We can see it.
The key question always. So thank you, Janet. So yes, That's me. I'm the Research M&E Coordinator for FEM International, and I'm going to talk about the evolution of the menstrual sector, future directions, taking a research and health systems perspective, my area of expertise. So just quickly, FEM International is a menstrual health NGO. We work in East Africa. Our services include menstrual program implementation, training on that implementation, as well as on M&E. And we have the Twaweza program, which is an NGO education and distribution program. And then the Twende initiative, that's a social business bringing menstrual resources and reusable products to communities. Lastly, we have our research study, which I'll talk a little bit about at the end of this. Putting into context, Marnie Summer was lovely enough to share this slide with me, showing the evolution of menstruation on the global agenda in thinking about programming, funding, and research. So we started off very small, individual interventions, often with a strong WASH focus, as we've seen from previous presenters, a very traditional model of give girls a pad so they stay in school, which we now know is overly simplistic, but it was still the first time anyone thought of addressing the issue, and this was a very feasible solution. Since then, we've seen a lot of evolution to broader evidence-based programming. And in the field, we're seeing these changes as well. We know that girls have extremely limited agency without broader programming, and that menstruation is so much more than girls and in the school setting. Across the board, we're seeing menstruators become the purview, we're seeing menstruation become the purview of multiple sectors and larger scale interventions, bringing these aspects together. The sector is becoming much more inclusive and holistic, which is incredible to see and so needed. There's a big change in the language we use. So, for example, health is much broader and less stigmatizing than hygiene. We're talking about menstrual products instead of feminine or sanitary products to reduce the stigma. Using the word menstruator to include all people who menstruate. We're seeing programming specifically for people with disabilities, for the queer community, for menstruators who are in prison or on the street or HIV positive, any of the specific overlooked groups who require more targeted attention and programming. We're addressing broader issues in our programming, understanding normal versus abnormal menstruation, the resultant disorders, and then the healthcare provision for them. Community-based approaches that include men and boys as well to tackle those more systemic issues. And lastly, we're seeing a huge increase in demand for M&E and tools, often coming from implementers themselves, which makes my little data heart so happy. Sorry, had to do a COVID thing because it's changed what we do so radically. It shut down funding for essential and primary services, leaving a lot of menstrual programming in a lurch. And this trend has pretty much continued, leading to huge and detrimental effect on these services. Menstruation doesn't stop for COVID, yet our ability to deliver programming has been sharply curtailed. The cost of delivering programs has increased with unbudgeted items such as masks or hand washing, etc., whilst there are fewer participants in each activity. So the bottom line is greater need whilst our reach has lessened. And just quickly, almost a year ago, we developed guidelines for community-based programming during a pandemic, which is a great resource available on our website if anyone is interested. Because menstruation is a systemic and multifaceted issue, integration within policy and systems needs to be the goal. And we've had quite some dialogue on that already today, which is excellent. And we're starting to see more of these. The Kenya, Scotland, New Zealand, and just this morning, France, the menstrual products in schools, and evaluation of these policies will be key to shaping future and similar policies. Within the healthcare system, there's a desperate need for education of providers. So for example, a 13-year-old girl isn't told to have a baby to solve her menstrual pain. So that myths are eradicated from evidence-based practice, and menstruators seeking care receive the care they require all the way up to diagnoses and treatment for things like endometriosis or PCOS. Menstruation is a public health issue. It's experienced by half the global population, and estimates of menstrual problems that can actually lead to severe long-term health outcomes are way underrated due to lack of knowledge, ability for diagnostics, and habitual overlooking of menstruators' complaints. Pain is the #1 menstrual complaint globally that makes people miss or reduce work, school, social life, etc. And interventions like FEMS have been shown to improve people's ability to participate in their daily life due to reduced pain, shame, and anxiety. So taking such community-based approaches into the public health and health system spheres has the ability to massively improve physical and psychological health for many menstruators, contributing to gender equality across the board, as well as economic and development gains at the national and regional levels. So here I'm going to go into my niche. I straddle the line, bridging a big gap that often exists between research and implementation. Research and implementers can seem worlds apart, and yet bringing them together is key to advancing menstrual equity. And when they do come together, it's magic because there's so much overlap in what they're doing. Unfortunately, this is often not the case, and these entities tend to operate on different yet parallel paths. Most of the issues separating these groups are about access, and I am going to focus very much on research and implementation, but this applies to funders and policy decision makers as well. For example, when we talk about speaking different languages, implementers are about their communities and the people, and it's immediate and right there, as opposed to researchers who are about information and conveying that specific dense information in a very prescribed format. And that format is often not very understandable to implementers and lay people. Some journals have started requiring a lay summary, which is a really great way for non-researchers to understand what the study is about and its messages. But then we run into issues of accessing that publication, which usually requires paid subscriptions that are not affordable. And unless somebody either has a research background or the organization has the funds to hire somebody who does, that's just not going to happen. Research institutions need to disseminate in a digestible and accessible format. And organizations and funders and policymakers need to make the effort to acquire existing information because it is out there. There are open access publications. There are organizations like the IMHER that have a lot of information on their websites. And so this is a real life example here, which is fun. The past study is a beautiful example, in my opinion, of research and NGO bridging that gap. I think part of the reason this can happen is because the menstrual sector was so young. Everybody was just looking for advice and information, wanting to collaborate to maximize scarce resources. The Eastern and Southern African Menstrual Health Research Network started in 2017 with a research grant that brought together researchers and NGOs in Kenya, Tanzania, and Uganda. And the network has since expanded with further grants. It's doing a lot of capacity building of young researchers, information dissemination, and is directly responsible for this research grant that we have now here in Tanzania, which is also the first menstrual research grant in the country. The PASS MHW project, Partnering to Support Schools for Good Menstrual Health and Wellbeing, is a 3-year feasibility study that takes FEM's current intervention, adds successful elements of other interventions, and evaluates it to create the sort of new and improved FEM 2.0. The project has 2 main goals, obviously to have a more holistic intervention that improves adolescents' menstrual health and well-being. See in the title there, nailed it. But more importantly, I think, to participatorily develop a model for NGO-governed partnerships. It's for an NGO-led school intervention that will include budget lines and that can be scaled. So this is very much implementation science. It's practical, it's applicable, it's accessible, and if it does what it should, the outcome will be a fundable and scalable partnership model that contributes to closing that gap by bringing in NGOs across the country or region into this model. And I'm just going to end there and say, because at the end of the day, it's not rocket science, it's a period, pun fully intended.
Thank you, Jen. It's one here, which is that
It looks like
I'm
Janet
there.
is. Oh.
Can you hear me? My
Oh,
sincere
yes. Now we can hear you. Now we can hear you.
My sincere apologies for that. So Neville is up next, and he'll be talking about what is next in advancing menstrual health policy in Kenya and in other African countries. So Neville, over to you.
Thank you so much, Janet. For me, maybe I just decided to talk from the heart, so I'll not be having a PowerPoint presentation. And basically looking at the case of policy and also how do we advance the same, especially in Africa. And one of the things that we've learned while developing the menstrual hygiene management policy in Kenya is iteration is very important. It's very important that as we go on developing any policy, not just the menstrual hygiene management policy, we should pause and reflect and ask ourselves, are we on the right track? Who's been left out and why have they been left out? And how do we bring them into this particular discourse? For the Kenyan case, we took about 6 years developing the policy simply because we were having back and forth, trying to gather as much evidence and as much information as possible, looking at the various groups and also how do we ensure that we've heard their voices. Then it's also important, even during implementation, just to pause and reflect also, because we might be doing the right things, but not addressing the needs of everyone. And when I mean everyone, is looking at these needs in isolation so that we ensure that each and every need is met. And at the same time, we ensure that these particular needs, as we are meeting the needs of the various groups, then we have different approaches for these particular needs. Then that said, how do we then look at persons with disability in isolation? How do you look at maybe MHM in the humanitarian setting? How do you ensure that we've looked at MHM in schools and even going further to maybe disaggregate the data that we have, rural versus urban, because it will have a different bearing. Then secondly, it's important for government to take strong leadership. And by strong leadership, it's not just leadership based on lip service, but rather, how do we then ensure that government has functions that at the same time are funded? Because it will be needless for us to have a policy that is not, one, implemented, and secondly, not funded. Because if that policy is not funded, there is a high likelihood that it is not going to be implemented. Then how does government come in to strengthen matters of coordination? We should look at how we are going to strengthen coordination in all these, of all the partners that are there in the MHM space, so that while we are undertaking MHM activities, everyone is able to undertake them in tandem with the requirements of the policy and what government presupposes to be correct. Then looking at also implementation, the role of government in also implementation is looking at reporting mechanisms. How do we then, even as partners and organizations, feed into the government reporting mechanisms, and how do we ensure that while we feed into the government reporting mechanisms, our data is able to reflect. Then thirdly, for the case of Kenya, we have the national government, and most of the functions, especially health functions, have been devolved to the counties. So when we develop the policy and the Ministry of Health as the host of the policy, then it's important for us to look at how do we ensure that these subnational levels have participated. And when it's a matter of participation, it is real participation, not a participation when they are called to validate the policy, but right from the start, we should involve them in each and every step of the way to ensure that their views, their voices, and also their activities are also included in that policy. Then look at maybe how would we strengthen integration, because MHM has been so strong in water sanitation and activities, that is water sanitation and hygiene. But MHM permeates across all other sectors. So how do we bring in sexual reproductive health into the MHM discourse? Because their take has not been that strong. For that, we'll also need to look at integrating MHM into FGM, into early pregnancies, into issues of family planning. Then lastly, how will we include men and boys into the MHM discourse? One thing that we always talk about inclusion of men and boys, but I can assure that it is not purposive and deliberate. It is at times just to tick the box that men were involved in MHM. And as we involve men and boys in this discourse, it's not like we are trying to steal the space of women and girls, but rather, how would me as a man know how to better support women and girls as they go through their menstruation? It will mean that I should have that pragmatic and factual knowledge about menstruation. For me, the first interaction that I had with MHM, with menstruation, based on that interaction, I always knew menstruation is a sickness. And it was not until 2015 that I knew menstruation is not a sickness, but a natural biological process of growing up. So how do you ensure that we bring up men and women, boys and men into this discourse and make it deliberate? Then lastly, it's important maybe for us to note that even for us as a country, we have a policy, yes, but this policy, if it's not implemented, it's just like some useless piece of paper. And the only way that we can ensure that we've implemented this policy is for all stakeholders to work together. And that will mean that government, private sector, and other entities have to come into this discourse. Maybe for now, that is what I wanted to add.
Thank you so much, Neville. I should actually mention that with regards to training or becoming a menstrual health trainer, Neville trained me. If that's not allyship, I don't know what is. His continued passion for constantly trying to get men and boys included in the conversation and for all the work he does is very notable. And to all the panelists as well, I mean, everything that you've all said, Kenny, Jen, Ibrahim, Titus, and Neville, has been so critical. And I now want to open it up to question and answer. There's a few I've captured. Again, in the interest of time, I'll try and divide some of the questions to certain panelists. And so the first set of questions, there are 3 in total. So unfortunately, I think we might only be able to answer 1 each and keep our answers short. Here's a question I think I would shoot at Ibrahim and Kenny, if we're all still there. Both the South Africa and Kenya programs ensure the supply of sanitary towels in schools. What measures have been put in place to ensure that all girls are receiving these sanitary products? So Ibrahim, if you're able to touch on that very briefly, Kenny as well, and then we'll move on to the next question.
Thank you, Janet. I want to say that the ministry has got a clear structured way of the distribution of these sanitary pads from the national level to the school, and at the school level, they are handed over to a patron, and this patron is a person who is always interacting with the students or pupils, as it were, when they come to ask for such kind of services. They know exactly how they do it because they have already been trained.
Okay, thank you, Ibrahim. I know that there was some matters around inconsistencies in distribution. I feel like that might be a conversation for another time, but thank you for highlighting that it's the patrons who do it. Kenny, what's the picture like in South Africa?
Okay, thank you very much, Janet. So I did actually answer this question on the chat, but let me just repeat myself. I think in South Africa, what actually happened in terms of the procurement, in fact, each and every province, we have 9 provinces here in South Africa. So each province has the sole responsibility to make sure that they appoint service providers who will actually deliver or distribute these things to the schools. So those service providers, they should actually be working with the school governing body and the school managing teams so that they can actually train them on how properly can these things be distributed to our girls, and also to keep the register for accountability purpose. So that is actually what was supposed to happen. But like as I've said earlier on in my presentation, some provinces are actually really struggling just to procure, just to appoint service providers to distribute these products to our girls and women in schools.
Right, and those are the gaps we need to pick up on. Thank you for emphasizing that again, Kenny. The next round of questions I'd like to address to Jen and Neville. To what extent are governments mainstreaming issues of menstrual health into education curricula? Maybe I can extend that to just mainstreaming matters of menstrual health. Your thoughts on whether that's been done, how it's been done, and what else needs to improve. We can start with you, Jen, and then let Neville answer.
Okay, thanks. A really good question, actually. In terms of curriculum, I think what we often see is that there might be some information, more like physiological information that students get in biology class, and they're getting it in their very upper years of secondary school. It tends to be very not practical. It tends to be very, anatomy, physiology. When there is information in the school curriculum, teachers tend to be completely unprepared and unable to handle it and teach it because they come from the same communities as the students. And so the same myths and taboos, teachers have them as well. And so there needs to be a change in the teachers' curriculum and the health providers' curriculum, because they as well come from the same communities and have those same myths and taboos and misinformation. And so it needs to be very much a lot of change at these larger systems levels for training of educators, of all healthcare providers, that sort of thing.
Yeah, makes sense. If you are part of the community, then it's hard to kind of do away with your own barriers to then try and educate. So that's a really strong point. Neville, your thoughts on mainstreaming it in the curricula and beyond?
Just a follow-up on what Jenny has said. One thing that I've also noticed, especially when interacting with teachers, we expect teachers to be teaching learners about reproductive health and growing up, and including why and how menstruation happens. But talking to teachers and even training them, teachers even have a problem mentioning the word vagina. And I think common sense will even tell you that you cannot talk about menstruation without mentioning vagina. And for that, one of the things that we've done is to look at the Kenyan education system and also the curriculum and look at the gaps that they have, especially when it comes to teaching matters of menstruation and MHM. So we worked closely with the Ministry of Education to develop the MHM Teachers Handbook that gives direction on how MHM is going to be taught in schools. So this particular document, the MHM Teachers Handbook, has already been passed by the Kenya Institute of Curriculum Development. And the only thing that you are waiting for is now, when possibly towards the start of the following term, we might be having MHM as a taught subject in the school curriculum, and especially looking at how do we ensure that it's taught in a creative manner so that learners are able to comprehend. But teaching it in the school curriculum is just but one thing. What of, that is formal education. What of others who might not go through that formal education? So it's also important for us to look at how do we then also ensure that community leaders and also religious leaders also take up matters of MHM education.
Thank you for that, Neville. Really, really important points. I know we are almost completely out of time. Somebody wanted to know a little bit about whether persons who are differently abled or different menstruators are included in policies. Maybe somebody can respond via chat box, just because of the interest and time, if any of the panelists wants to answer there, because unfortunately we are out of time. Somebody else mentioned, I think a lot of you didn't leave your names yet, that is lack of menstrual education for boys. What can be done to ensure boys and men are educated? I believe our panelists, some of them kind of alluded to that, which is just kind of extending the conversation at a very early age, including it in schools, including it in community engagements. So again, if any of our panelists have comments on how differently abled persons are being included in policy and ideas around including men and boys, please add them in the chat box as I proceed to make some closing remarks, just because we are unfortunately completely out of time. And before I thank our panelists, I just want to make some quick closing remarks. First of all, when it comes to mainstreaming menstrual health, I remember a feature called Periods of Shame, which aired on Citizen TV in Kenya back in 2013. It was one of the very few times that a topic like menstruation had been broadcast on a public news forum, especially at primetime news in front of the country. And I can say it changed a lot of things. I think it kind of began to propel the conversation around period poverty. It forced the government in some way to increase budgetary allocation. The First Lady was invested in the conversation. And so I know firsthand the power of mainstreaming the conversation on menstrual health, because you have a wider demographic of the public being included in these conversations and participating in implementation, participating in lobbying, participating in speaking up and speaking out. It makes a difference. So wherever you're watching this from, if you're able to kind of have these conversations in your spaces, it begins to make a difference. And officially, the closing remarks is to acknowledge the great work that's happened and that is happening. Thanking our esteemed panelists so much. Thank you all very, very much. Jen Rubli, Ibrahim Basweti, Neville Okwaro, Titus Oyo, and Kenny Pasha. Thank you for your passion. It was very palpable throughout this panel discussion. Thank you for all the work you're doing. We appreciate it and we want to applaud you and all our other allies in the space of menstrual health. Diana, who's with Days for Girls, UNFPA, and all the incredible work that you do as well. Thank you, thank you, thank you. And as I shared at the beginning of this webinar, the theme for International Day of the Woman recognizes that women and girls are playing pivotal roles to help shape a more equal future and recovery from COVID-19. And part of this holistic approach is advancing menstrual equity through policy shifts and standards. Today, we heard how alert some governments are, and kudos to the governments doing incredible work. How they're choosing to change the menstrual health of menstruators in countries by putting menstrual health policies and ensure that women and girls have an equal future, and overcoming challenges of period poverty. And I can't emphasize it enough. We do need this at the heart of government policies. We do need implementers and policymakers to make this such a core part of the work they're doing, because when it's prioritized at the government level, it's kind of embraced by the community and society. And when we don't see that, if it ends up being very lax or sort of something that's addressed on the side, then that's how it's perceived. And as somebody who has had problematic issues with my own menstruation, but is lucky enough to have access to medication and to products, it pains me every single day to know that there are so many women and girls who don't have that same access. And so I think we need to kind of amplify this conversation and make sure that there is access to knowledge, to medication, to proper products, products that are approved, for instance, by KEBS. We need that to be part and parcel of our everyday call to action. It's something that I talk about pretty often. And just in winding up, and to remind everyone, this has been recorded and the recording will be shared with all our participants pretty soon, as well as a report capturing important elements of this as well. And we hope this information has allowed a lot of you to go out there in your advocacy efforts and to be able to advance menstrual equity at the systemic level in your countries through policy shifts and through standards. Let's just continue to keep this at the heart and soul of conversations around reproductive health, health and rights, and gender equality. Menstruation affects so many people. It's not a taboo. It's not something that should reduce people to feeling dirty and not seen, but unfortunately in many spaces it does. So let's normalize menstruation and let's normalize interventions in menstruation. So with that said, thank you all so much. If I can just ask our panelists to wave at everybody who's been watching. And we want to once again thank you for your allyship and for all the incredible work you're doing. Thank you all of you for watching. Thank you all so much for attending. Wishing you all the best, and we look forward to you receiving this recording as well. I'm Janet Mbogwa. Thank you for watching, and we'll see you soon. Goodbye.
Thank you very much.
Thank you.
Thank you.
Thank you.